about it, and he had this quote, which I just thought was really interesting, that he was like talking to strangers about how you feel in a doctor's office is a strangely bonding experience. So you wouldn't necessarily think it would be, but it turns out that it is. So the second part, so the first part we ask people to reflect on past experiences. And then in the second part of the workshop, we ask people to project in the future for a future experience that they might have. And we ask them to go through an exercise that we call Plan Your Conversation in kind of a practice session. And so we've created these 5 cards, condition agnostic, they can be used for absolutely anything. And truthfully, they're a framework that you could probably use for any conversation. We've kind of narrowed it into a clinical conversation. But the first card is I want to talk about. The second is it's important to me because. 3 is it might help you to know. 4 is I want this conversation to lead to. And 5 is I'm nervous this conversation will lead to. And so within the workshop, people fill theirs out. They fill out their cards, and then we pair them up. And they practice kind of talking through the issue with somebody else within the team. And a lot of this idea emerged from, again, recognizing that we put an enormous amount of resources, time, and training into clinicians, how clinicians can get better at doing their job in that exam room, but we do almost nothing for patients. And so this was kind of a version of simulated patients that was like simulated doctors or simulated visit, that patients could practice a little bit what they might say and sort of hear it out loud. And a lot of the feedback we've gotten from this is it helped me organize what it is that I wanted to say, and then when I went into the doctor's office, I had so much more confidence about what it was, because I'd sort of thought through it and worked through it a little bit. And those types of things were things we heard over and over again. So another tool that we created was kind of a I Can Light version that we, Matt, who is my other colleague who's worked with me a lot on the patient revolution work, we spent about 3 weeks prototyping and trying things out in the primary care practice in New Haven, Connecticut. And we were interested if we could kind of isolate down to maybe kind of 4 key questions that could be used in the clinical space that might give some contextual information to the physician. And so the first is, tell us one non-medical thing about your life that you think the doctor should know. Then what's one thing your doctor's asking you to do that feels like a burden or is harder than it should be? What's one thing your doctor is asking you to do for your health that's helping, that's making you feel better? And then lastly, sort of where do you find the most joy in your life? And it was really interesting as we did the research, we found that oftentimes the thing that feels like that your doctor's asking you to do that feels like a burden and the thing that's helping were the same thing. And people would say, my doctor's asking me to eat better, and I'm really trying. I'm really making an effort. I'm not doing it all the time now, or I'm not exercising all the time. But I can see how it's good for me, and they really, this idea of recognizing effort, that they were trying to do something, was incredibly valuable to them. And then we had one of our favorite stories is for where do you find the most joy in life. We had one gentleman who was there with his wife, and he was making his wife fill it out for him. And so she asked him, where do you find the most joy in life? And he was like, sex. And she kind of looked at Matt, happened to be in the room with them, and she looked at Matt and she wrote, love life. And it was extraordinary. So we were talking to the physician afterwards, and he was like, this is great, this is amazing. He was an older man, maybe in his 50s or 60s, and so he was like, this is actually really helpful, because if I know that this is something that's really important to him, I can think about medications, many of which can have sexual side effects, differently, and kind of coming from that point of view. So it also, that was another example of, which I think has been mentioned here a few times over the last couple of days, but is also at the kind of core of the patient revolution idea, which is that when you create opportunities for clinicians to be able to care for their patients, that in and of itself is an intense motivation to keep doing a lot of this type of work. Because that feels good. Those of you who are doctors and here are clinicians and here, you wouldn't have gone into doing this type of work if there wasn't some value in that for you. And so tapping into that is a big part of what we're trying to do. And then another model that we've been playing with, I wish I had some pictures, but instead I put these couple of pictures. We've been calling social shared decision-making model. And so the idea here is, again, because we're trying to move into thinking about doing things more at the community level, we've kind of tried to push our thinking a little bit. And so we took the idea of the shared decision-making, and we said, well, what if that wasn't only for the clinical encounter? What if that was actually something that we did out in the community in some way? And really the idea was to divorce it from decision-making at that particular moment. And so the model, which Summer helped us out with a lot, and we've been working with some people in New Haven, and we've done about 4 of these between the 2 places now. But the idea is we started off with the topic of mammography, so mammography for women who are in their 40s. So really thinking about it as it's perfectly reasonable to decide to get a mammogram, and it's perfectly reasonable to decide not to get a mammogram. But one thing we do know is that as soon as that woman visits the doctor after she's turned 40, she's going to be asked or told to get a mammogram. And so we were thinking, well, how do we prepare people for that moment? Like, so here's an instance where the diagnosis or the question that we know is going to come up has a moment in time. We can pinpoint it, so we can actually work ahead of that to maybe potentially share some information or create the possibility for people to begin to work through this situation. And so that's what we did here. We had somebody host it in their home. They might invite 8 to 12 people along. Hence we call it the Tupperware model. And they, a lot of the ones we were at also had like wine and snacks and things like that, and they all come together. Matt and I do most of the facilitating, so designers or facilitators in that role. And we had a physician there, but the physician didn't necessarily lead the event, so was there to contribute and answer questions, but not as the kind of authority over the total event. And we just, similarly to how we do in shared decision-making activities, we shared a lot of the evidence, and we created the opportunity for people to talk about how they really responded to it. And again, the thing I think is really interesting here is not only creating space for people to work through for themselves, but to also see other people working through. It creates an awful lot of empathy at potentially the community level. So to begin to understand how 2 different people could look at the same information and end up at a different place. And really reconfirm the idea that wherever you decide what you decide to do or not decide to do is perfectly reasonable, and that makes sense for you. And then we would, following the Tupperware model, oftentimes someone from that event would want to host another one. So we'd follow that person, they'd invite from their circle of friends, and kind of go forward. And so we think that this is a really, really exciting model to imagine for kind of health discussions that could move into the world. And we've begun to think about, we're working with an endocrinologist and a cardiologist in New Haven at Yale on these, and so the endocrinologist was talking a lot about maybe we could do an event like this and help people with diabetes, type 2 diabetes, be able to set their own A1C targets, that sort of idea. Or discussing cardiovascular risk, or other types of screening things that, again, we can pinpoint, and we know there's a moment in time when they're going to be asked about that. So we provide information about colon cancer screening or other types of preventative screening. So that the moment when the physician or the clinician asks them in that room isn't the first time that they've ever given it any thought. So those are some of the things we've been playing around with. We, at this moment in time, as Victor said, we've kind of spun out into our own nonprofit organization, and we are confident that there's something here that we would really like to turn into a larger movement. And so we're playing a little bit with our mission statement, but this is part of the idea that we're thinking about here, that it's an action and advocacy movement for careful and kind patient care, that it supports patients and the public in pushing stories into the clinical and public sphere that remind us of the importance and the possibility of empathy, compassion, and generosity in healthcare. And the next slide has the exact same thing, although I was going to reveal at this point that we're on our own nonprofit. So we've spun out and we're our own thing. And so we're in the process right now of reaching out to communities and individuals. We're going to make all of our tools and support available digitally through our website. We're kind of in the process of revamping that, which a version of that will be up in the coming weeks, and then we'll continue to evolve and grow over the coming months. We're exploring strategies again to connect and reach with more people, and looking to communities to collaborate with. And so if you have people that you think we should meet, stories you think we should tell, please absolutely reach out, because we're looking for those types of collaborations. And thank you. And that's me, that's our website, that's our Twitter, and
so you have 10 minutes for questions, comments, thoughts, irritations. Yes?
Well, I was listening to your story. I was thinking about when you want to change things, or you want to even cause a revolution, you have to really define the problem first. Because if I ask many Dutch doctors about decision making, for instance, they say, well, that's something we already do. And if you would come and say we should give careful and kind care, they say that's obvious, that's what we do. So if you don't have the problem clear, then the revolution might not succeed.
yeah, so I think that's a great point, and a big part of what we've found out is that words are weak in explaining the problem, and that if we only rely on words or descriptions of the problem, that it just lacks any kind of weight or punch. And so that's a big part of why we've been doing a lot of these workshops and other reflection activities, especially at least for patients, but I think it's also would also be